Ovarian cancer, often called the silent killer, really announces itself with clear symptoms, making early detection a persistent challenge. Many women experience vague signs, bloating, pelvic pain, fatigue, that are frequently mistaken for less serious conditions. As a result, most cases are diagnosed at an advanced stage when treatment options are limited and survival rates drop significantly. This panel, Ovarian Cancer Breaking the Silence on Symptoms, Screening and Survival, is being organized by Voice of Healthcare in collaboration with Lupin as a supporting partner on the occasion of World Ovarian Cancer Awareness Day, with the aim to raise awareness, share cutting edge developments in screening and genomics, and highlight the urgent need for education, advocacy, and equitable access to care to improve outcomes for women everywhere. So the silence must end. Our speakers for today's panels are Dr. Jyoti Bajpai, consultant medical oncologist, Apollo Hospital, Mumbai. Welcome, Dr. Jyoti.
Thank you very
Dr.
much.
Vibha, Dr. Vibha Naik, consultant medical oncologist, Sterling Hospital, Vadodara. Dr. Vibha would be joining. Dr. Manasi Shah, consultant medical oncologist, SCG Cancer Hospital, Ahmedabad. Welcome, Dr. Shah. Dr. Darshna Rani, consultant medical oncologist, SCG Cancer Hospital, Mumbai. Dr. Darshna would also be joining us. Dr. Mubarak Kunisa Tonse, consultant medical oncologist, Kambala Hill Hospital. Welcome, Dr. Tonse. Dr. Uma Dangi, consultant medical oncologist, Fortis Hospital, Mumbai. Welcome, Dr. Uma.
Thank you so much for inviting us. Thank you.
So my first question goes to Dr. Jyoti. That, ma'am, what are the early signs of ovarian cancer and why it is diagnosed so late? On follow-up.
So I guess it is an extremely relevant question, and this is most important. And as you very rightly started in your beginning statement, it is called a silent killer because many times, majority of the times, the symptoms are very non-specific or vague, like bloating, yeah, like early satiety, distension of abdomen, those kind of things. At times, occasionally we also find some vaginal bleeding, etc., but that is much less common. So these bloating, distension, all these symptoms can be due to multitudes of reasons. So that's why people keep on neglecting and thinking that is due to something else. Majority or more than 3/4 of the cases get diagnosed and stage 3 plus or 3. So that's where we are.
Right, ma'am. And as you're holding, leadership position in Society of Immunotherapy in Cancer and Immuno-Oncology Society of India. So what are the most promising biomarker to predict the patient response? And how are these reshaping the personalized treatment for the patients of ovarian cancer, especially who are diagnosed so late?
So again, I think extremely important question in today's context. I would say that in ovarian cancer, the management generally is like that. We combine chemo and targeted therapy with surgery, and that encompasses a multidisciplinary team approach for the best of the results. And with these combination, we are having good results. As far as personalized therapy or precision therapy or immunotherapy is concerned, these targeted therapy like bevacizumab or other anti-angiogenic agents which work in these cancers. So especially if there is an ascites or the fluid accumulation, this therapy works better. Also in even platinum resistant cases, we see that the response to these kind of drugs are good. So these are few of the things, especially if you have to take a judicious approach where economics also comes into picture, then we take all these notion. Otherwise it this targeted therapy works in right from the upfront cases, even in later lines. So that is one aspect about immunotherapy. At present it is not working so well as in cervical cancer or endometrial, that is the other gynecological cancer, and many other cancers, but still in later lines, we can consider those, especially the biomarker of importance here, as you rightly asked, was MMR or MSI. So this is called microsatellite instability. And as you pointed out that, I contributed towards the global guidelines for Society of Immunotherapy of Cancer, and as part of the core committee member of SIDBI and the founder secretary for Immuno-Oncology Society, our message is very clear that these immunotherapeutic drugs works when these agonistic, these are called tumor agnostic markers, like if it is MSI high or MMR present. So in these cases, immunotherapy works. So we have to very judiciously and precisely choose in clinics. But otherwise, targeted and chemotherapy has a much bigger role in these cancers. Thank you.
Right. Right, rightly said, ma'am. And as this is an awareness campaign, I believe that we should not wait for ovarian cancer to go to later stages so that we have to use these immunotherapy and other drugs. Of course, they are available. So our target should be early screening, early detection. So this is what is this particular panel is about, and that is why I want to ask Dr. Manasi that are there any effective screening methods currently available for ovarian cancer in India?
So that's a very important question, especially, because if it is such a dreadful disease, then we want to detect it early. Unfortunately, there are no good screening tests that are available for ovarian cancer. For such general population screening, we don't have any tests. In patients whom we consider high risk, ovarian cancer, about 25% patients have a hereditary risk of ovarian cancer. So, if there is a strong family history with breast cancer, ovarian cancer, pancreatic cancer, any of those cancers, then we do a blood test to see what is your risk of developing ovarian cancer. For certain mutations, like they're called BRCA mutations, the risk for ovarian cancer is almost 50 to 60%. So, in those patients, we do a blood test called CA125 and an ultrasound of the ovaries, say every 6 months, once the patient is, say, at least more than 25, 30 years of age. But that is only for high risk people. For general population, as of right now, we don't have any screening tests.
Right, ma'am. So I believe if there is a genetic predisposition, what we can do is we can do screening more frequently, as you rightly said, with the help of CA125. Dr. Uma, how can women at a higher risk, especially as we are talking about the genetic predisposition and family history, be identified better, and they can be managed as well better?
Yeah, so I think that's a very valid point. We are all, ovarian cancer, like everybody rightly said, that it's always caught at a higher stage. And it would be really wonderful if we could catch it early and, try to cure maximum number of patients. And yes, one way to do it would be to identify patients or people at a very high risk. And how do we do that? It's very important to understand the family history of the patient. If there's a strong family history of either breast cancer, ovarian cancer, pancreatic cancer, or even prostate cancer in the family, then there is a good chance that these patients could have a hereditary risk. Now, hereditary risk mainly means that you have inherited certain genes which may be mutated and which are leading to the higher risk of you developing ovarian cancer. So to identify these people, firstly we have to understand their family history. And if the family history is strong, or in some families there may already be a person who has or a first or a second degree blood relative who has already been tested positive for a high risk mutation. So such people, if identified, need to undergo a genetic testing themselves to see if they are carriers of such a genetic abnormality. And if they are, say, like Dr. Mansi Shah mentioned, BRCA1 mutations, BRCA2 mutations, any other mutations which may predispose to ovarian cancer, if we detect certain mutations, then these patients can be added, can be put on a certain screening program where ultrasounds and CA125 are done periodically. In these people, we may even suggest that you should maybe complete your family early, and we can offer prophylactic surgeries like getting rid of the ovaries surgically at a very early age, like by 38, 40. when usually women achieve menopause, so that developing cancer in these organs may can be prevented. So certain options, all these things can open up if we are able to identify these people, and the way to do it would be to do a genetic testing in patients who have a family history. So we can't genetically test the entire population, but certainly we can identify who they are and try to do their tests. Thank you.
Right. So I think we can advise them on completing their family as well and do the prophylactic surgery as well. This is a very good message, Dr. Uma. Dr. Dashna, so my question to you is that what are the latest advancements in diagnostic technology and treatment option for ovarian cancers?
So good evening. So this is a very important to understand that we have a lot of options now available for the diagnosis. And so previously we used to do the CA-125, which is a blood marker, and we would do sonography or a CT scan or an MRI to see the tumor. Now we are doing more advanced imaging methods like PET-CT scan. And apart from that, since sometimes it is difficult to get a biopsy, so if the patients land in a very advanced stage, so if there is a fluid in the body, in the abdomen, that is in the tummy, because of the disease, then that fluid also can be collected, and the cells from that fluid can be then subjected to testing, which can negate the need for a biopsy. Also, on the biopsy, we do further advanced tests, which are known as next generation sequencing, and this test is now easily available. These tests help us to detect the mutations and the genetic makeup of the cancer, and also help us to direct our treatment accordingly. So if there's a mutation, then we can target our treatment to that mutation specific. Also, if that is also difficult, then we can do testing on the blood for the tumor markers, and for the also an NGS like technique, which can detect what is the origin of the cancer, and that holds true for any solid organ malignancy. Apart from the investigations, we also have advancements in the treatment. So it's not just the surgery, chemotherapy. Now we also have targeted therapy, which are specific therapy. They cause less damage than the chemotherapy, and they have better long-lasting effects, less side effects, and more improved survival than the routine chemotherapy. And also we use immunotherapy. So immunotherapy has come a big way. We use immunotherapy also here. Also, like my colleagues have mentioned, if there is a mutation like the BRCA mutation, which is a genetically linked mutation that runs in the family, then we have specific drugs available for that mutation that we can treat our patients with. So this is something very important. And it's a tailor-made prescription for all our patients. So definitely a lot of advancement. Thank you.
Right, rightly said that we don't only have the radiological investigations which we can use. We also have the genomics now. That genomic test can be done on the solid tumor itself or in the blood. And if there is any fluid in the tummy, that should not be ignored and that should definitely be tested. Um, so, Dr. Tonse, how is personalized medicine like targeted therapy and genetic testing changing the outlook of ovarian cancer patients?
An excellent question. Because ovarian cancer, we know that it is diagnosed late and stage 3 and stage 4, and the outcomes are very dismal despite of chemotherapy, adequate surgery, and despite of maintenance with bevacizumab kind of anti-angiogenic therapy. We do certain tests like germline BRCA1 and 2 tests.
Tonse, you're not audible. I
Uh,
think.
can you give us more
Yeah.
information? about use of certain molecules called as PARP inhibitors. These PARP inhibitors are very good molecules in ovarian cancer. They have helped to improve the outcomes in advanced ovarian malignancies.
There's some network issue, Dr. Thompson.
When you hello, can you hear me?
Yes, now,
When
can you please repeat what you were saying?
yeah, uh,
Maybe, Mobina, you can switch off your video so the
so we
bandwidth
do
issue will be
certain
resolved.
tests called as German BRCA testing, BRCA and an HRD test.
Not audible. Dr. Ronse, you're not audible. I think,
Can
yeah,
you hear me now?
yes. So you'll have to repeat.
So you have to do a test called a germline BRCA test, a somatic BRCA test, and a HRD test. Okay, when we diagnose the
All right. I
Maybe you
think
can
I'll take
reach
up the
out to her slightly later in the interest of time, right,
yeah,
Dr. Kurana?
yeah. I think yes, that is a good idea. So Dr. Vibha, are you there?
Yes. Yes, I'm there.
Okay.
You can hear me?
Yes,
Yeah.
definitely. Welcome, Dr. Vibha. So
Yes,
I
thank
think
you.
so. My question to you is that you can tell our audience that what are the early signs and symptoms, and how can we catch the ovarian cancer early? One, and secondly, how important are the patient support group in the journey of ovarian cancer? Since you are a clinician, you must be treating them on daily
Right.
basis, and how can we influence them to get themselves tested and screened early?
Yeah. So ovarian cancer, as we all know, is a difficult cancer to pick up early, unlike breast cancer, where you can palpate and, detect the lump. Because it is a pelvic organ, usually it is diagnosed in a late stage. But we can educate the general public to look for symptoms for detection of early cancer, early ovarian cancer. It is like fullness in the abdomen, lower abdomen. Sometimes the early symptoms would be like difficulty in passing urine or stool. So these are some of the early signs which should not be ignored. Like you have a normal habit of passing stool and urine, and suddenly you have fullness in the lower abdomen, you have a dragging pain, or you have difficulty passing urine or stool. You have early satiety. You eat and you feel full. I mean, you eat little food and you feel full. So these may be some of the early symptoms of ovarian cancer, which need not be ignored, because some of the patients come to us in very advanced stage where they develop fluid in the abdomen with ascites. So it is very important to look out for these symptoms and not ignore them. You can consult your local gynecologist who can run certain tests. The the test that they usually do is the ultrasound, and if they find that there is some mass in the ovary, or there is some abnormality, there is some complex cyst, they would do certain blood tests like the CA125. And sometimes when the CA125 is elevated, the other tests would be done for you, like the CT scan or the other test. And it is very important to pick it up early, because usually when it is picked up late, it becomes inoperable. And there are different treatments which are first offered and then you go for surgery. So definitely, since I'm a medical oncologist for the past 30 years and I've been treating a lot of ovarian cancer patients, the self-help groups is really very helpful, because if a person is cured of a particular cancer, ovarian cancer, can be of great mental support, emotional support for the other patients who are diagnosed with ovarian cancer. The only message that I want to give is that you don't have to be now very scared that, okay, you have been diagnosed by ovarian cancer, because now there are very good integrated clinics for cancer, where there is a medical oncologist, a surgical oncologist, a gynec oncologist, who sit together and plan the treatment. So what has to be offered first, whether you'll be offered some form of chemotherapy first, or you'll be taken up directly for surgery. And certain times there are also intraperitoneal chemotherapy which is offered. So there are different ways now to conquer this disease. And as rightly my other panelists have suggested, that there are genetic testing which is available. And if you are harboring a genetic mutation, then there are other drugs also like PARP inhibitors, which can be offered to you for better survival. So it is better to diagnose early. And if you have ovarian cancer, then it is better to treat it in a proper way, in a proper center, where you have a facility of a surgical oncologist, medical oncologist, because it is basically a disease where it is a multidisciplinary approach.
Right. I think this is also a very good message that it's a multidisciplinary approach, and we have to tailor make the treatment for each patient, and depending on its genetic makeup and depending on the stage at which it is diagnosed. So, Dr. Jyoti, what role can survivors play in raising public awareness and breaking social stigma around gynecological cancers?
So I think it is very, very important, and I would say that holding hand is an extremely important kind part in cancer journey, and no amount of motivation from doctors, paramedical workers is as important as a patient or patient's family when they speak to other patient. And because I see it as like there is a horizon, and at different points different patients are standing. So in some patient the journey is just beginning, and with a lot of apprehension, fear of unknown, uncertainty, all those parts are there, while some patient who is already in midway of the treatment, and some patients already crossed, and some who's in the follow up. So these all people can handhold each other and different ways, and can really leads to lot of confidence and faith in the system, and motivate other people to keep moving. I would give an example of one of my patient, and she was extremely dear, Mrs. Divya Mathur, who was diagnosed at very young age. So young cancer are my passion, and she was diagnosed in very advanced stage while she was barely 32, 33, a small child. And then in her 15 years journey of a very brave journey, she in spite of diagnosed at stage 4, she could complete those 15 years, and large majority of those years were quality years. And there was a support system from the family and the friends and other part that was extremely important. And she herself become an motivator to several hundred patients. She was even part of our press conferences, our she was our poster child, I would say, to motivate many patients. So I think it is extremely important. And when the patient they relate themselves with others. I would give an example of Angelina Jolie. Everybody knows her. So she belongs to a BRCA family. Her mother and grandmother, they both succumbed to BRCA positive breast cancer. So when she diagnosed as a career, she was not having even the disease. But then she decided to underwent a radical surgery, bilateral mastectomy, and reconstruction. So that act and that coming into public and giving that information leads to the genetic cancer awareness several hundred folds higher. After that, whichever forum I go and give a talk, people ask me about the BRCA cancer, genetic cancers. So one celebrity, one motion can leads to that kind of awareness. So the support group and all these people are of extreme value, and we need to really request them. We need to bring them into forums and help each other, so that we can really, I don't say even fight it out. We can complete this journey much smoothly. And as you accept and as you see the other people are doing the similar path, your fear goes down. And you I have seen in several thousands of patients, if you keep that positivity, that positive attitude, fighting spirits, team spirits can take you a long way. So I completely believe in support groups.
Right, right. I think this is the way forward, that to create awareness and to support those who are suffering. Dr. Manasi, what are the common myths and misconceptions about ovarian cancer that need to be addressed? Please unmute yourself. I can't hear you. You're not audible. Yes. Hello. Hello. No, you're not audible. Okay. So, Dr. Uma, Is it possible for ovarian cancer to impact pregnancy, or uh, anything which can occur during pregnancy? And what do you suggest, patients suffering from ovarian cancers?
So that's a very important question. Obviously, when patient has ovarian cancer, so in young age, now there are different types of ovarian cancers. Actually, I think majority of us, when we are talking about CA125, we are talking about the type that is called as epithelial ovarian cancer. But then there are other types of ovarian cancer which are seen in younger women, like germ cell tumors, etc. Or sometimes there are cancers which are low grade. So in such situations, one can try to preserve fertility to sort of allow for pregnancy in the future, especially for women who have not had because they're young, they probably not completed their family. Yeah, but by and large, when ovarian cancer occurs, and especially like we are talking about in advanced stages, then it is very difficult to save the ovary. So definitely you have to remove it. So obviously future pregnancy is obviously not an option. But yes, in early stages, in certain histologies like germ cell tumors and low grade tumors, in younger age especially, we can try to preserve fertility by doing a limited surgery. uh, Obviously, when a woman is pregnant and is simultaneously diagnosed with ovarian cancer, it is a very complex decision, because we have to involve so many people. We have to involve the obstetricians, we have to involve the surgeons, because we have to see how far she is into pregnancy, if she's in early trimester, because this treatment, because ovarian cancer, like we saw, if especially in advanced stages, it can be life threatening. You have to treat it urgently. So we can't wait for the pregnancy to be over. So then we have to talk about termination of pregnancy. We have to see what best we can do, what drugs might be safe during pregnancy. All these things have to be taken into account. So it's not an easy task if the woman gets pregnant and she's detected with ovarian cancer simultaneously.
So, if I
Tough
may just
decision.
add here, Dr. Khurana, so I just want to give this information that in my prior, institution, Tata Memorial, I've started a gestational cancer registry. It is one of its kind because in world over there is a handful of registries which are pregnancy with cancers. So we have started this first of its kind in the country and this part of the world, and majority of these cancers happen like breast cancer and cervical, and ovarian is much lower down. But yes, if this is happening, we have to judiciously involve multidisciplinary team, including the fetal medicine expert and trained obstetrician, apart from medical oncologist, surgeon, etc. And then because there is so much advancement, this is a trimester dependent care, and we have to very judiciously see that which trimester we are detecting and what stage it is. Depending upon that, we can offer them a judicious treatment. Some of the drugs like taxanes, which is one of the backbone in even ovarian cancer and like breast, it is shown a good safety outcome second trimester onwards, and surgery can be conducted in
Second trimester, yeah.
almost all trimester surgery can be done.
First
So
trimester
that
is
part
usually
we can,
avoidable, yeah.
that part we need to taken into account, and with that we can manage the patients appropriately.
Right, and it's a tough decision, I believe, and it involves lots of specialities as well. Right.
Yes.
So, right, Dr. Darshna, can you tell us that whether PCOD or PCOS increase the risk of developing ovarian cancer or not?
This is a very frequently asked question, actually. So, what is PCOS? Is a polycystic ovarian syndrome or a disease wherein it's basically a hormonal imbalance, wherein there are menstrual irregularities, there is hirsutism, and the ovaries show multiple cysts on a sonography or any other imaging modality, and they are usually associated with other metabolic imbalances like obesity, diabetes, dyslipidemia, fatty liver, and cardiovascular abnormalities, mood disturbances. Now, the common thing between the two is a long-term unopposed exposure to the hormone estrogen, the female hormone estrogen. So the continuous estrogen exposure causes both the PCOS and even the ovarian cancer. The reason for the ovarian cancer is also same. It also has a similar spectrum of risk factors like obesity and other high risk lifestyles like smoking and all. Now, though it is not directly linked, like it's not a cause, like PCOS will not really lead to ovarian cancer, but the reasons why PCOS does occur, the lifestyle and the metabolic abnormalities, that itself are the same risk factors and reasons for ovarian cancer. So though it's not a direct effect, but yeah, they have the same baseline and the same risk factors and the same uh, kind of uh, reasons, the chronic estrogen exposure. So that is the only connect. Thank you.
So that's rightly said that cancer is a lifestyle disease, and whatever the predisposing factors are there for PCOD, so those can predispose a woman for ovarian cancers as well. So, Dr. Tonse, what are some simple actions that communities and families and individuals can take to promote ovarian cancer awareness? Dr. Tonse.
Hi, can you hear the question?
Yes, we can hear you. Please unmute yourself, Dr. Tonse. Okay, Dr. Darshna, can you take this question?
Can you repeat the question, please?
What are some simple actions and communities, that communities, families, and individuals can take to promote ovarian cancer awareness?
Yeah, so this is very important. So ovarian cancer, as I mentioned earlier, is because of the lifestyle, the disordered lifestyle that we have, mainly smoking, tobacco, the alcohol, obesity, which is so common even in the young girls. That is something that we need to really act on, to increase the physical activity, to eat right, to sleep well, to prevent the stress level. Also, once the patient or the person has some symptoms, it is important that they do not delay in taking care of themselves and do not report to the doctor late. So generally women tend to, even to this date, even the working women, they tend to ignore their own health. So even if there's some pain in the tummy or some urinary disturbance, they tend to ignore it. So it's important that they prioritize themselves and they report to the doctor early. If the doctor, get the sonography more proactively. That is a basic test that can really detect some ovarian mass or abnormality. Secondly, as others suggested, that it is important to have a peer group of patients and survivors who can really spread the awareness and give a positive information to uh, the population in general, in their societies, in their whatever communities that they are in. So and definitely the family of the cancer patient should understand that how the whatever the emotional challenges the patient faces, that also needs to be taken care of, and they should be really supportive in all aspects, not just physical but also emotional and financial, to take help to help the patients.
Right. Dr. Manasi, please say hello so that I can hear you. Dr. Manasi. There was some, I could not hear you earlier. I can see you, but I can't hear you. No. Okay, so Dr. Uma, you will have to bust some myths around ovarian cancer.
So the most important myth, what I come across in my clinic is what I'll tell you. Many times, people do undergo pap smear for cervical cancer, and what happens is that many women feel that pap smear is for all gynecological cancer, including ovarian cancer. So that is not true. Please understand that pap smear is very, very exclusive for cervical cancer. And for ovarian cancer, right now, even if there is no screening for average risk, the usual way we diagnose is on ultrasound or a CT scan, or with a raised CA-125. And obviously, the gold standard for any diagnosis is a histology. Other myths surrounding is that if somebody was saying, if you have PCOS, I'll definitely get ovarian cancer. Though there have been mixed studies, but it has not been clearly shown to be causative of the reason behind developing ovarian cancer. So just because you have PCOS does not mean 100% you are going to get um, ovarian cancer. Secondly, a lot of times people say that if I don't have family history, that means I will not get cancer. So if, like, somebody mentioned before that hereditary ovarian cancer is probably about around 10% or so, it's not more. So many times ovarian cancer is a sporadic disease, so you need not necessarily have a family history. A lot of times the other risk factors, like being pregnant, breastfeeding, etc., if I have done all this, I will not get. No, cancer can affect anybody at at any age. So it is important to be aware of the signs and symptoms, so you can consult your doctor right on time, so that we can try and treat you at an early stage and result in the best cure. So don't try to self diagnose is my message. And please consult if you have any symptoms. Thank you.
So I think this message is very important, that if they get their pap test done, it doesn't mean that if it comes out to be negative, that means they are not suffering from ovarian cancer. So pap doesn't mean linked to the ovarian cancer, right? So Dr. Vibha, I would like to know that is digital health helping you in any way, transforming the diagnosis of ovarian cancer, helping you treat the patient better, or in patient monitoring, the digital tools, or the AI which is coming up?
See, it is too early actually to comment on that, because basically it would predict the risk. So if you have, like my panelists have suggested, that there are certain risk factors like your lifestyle. If you are like obese, you're smoking, or you're like alcohol, and you have a family history. So probably those parameters need to be corroborated, and we need to have certain digital AI platforms which will help us tell us the risk of developing ovarian cancer. Definitely, we have tests now, like the NGS panel, the HRD panel that we do for knowing whether you are harboring a BRCA1, BRCA2 mutation. Now, all patients who harbor BRCA1, BRCA2 mutation are not going to develop ovarian cancer, but definitely the risk is much higher. So they need to be screened, and probably, then they can go for prophylactic surgeries, as Dr. Jyoti had pointed out, or the case of Angelina Jolie. So these are some of the tools that we can use to, pick up ovarian cancer early. And in my practice, definitely we don't, I'm not using any digital tool right now to detect ovarian cancer early. But definitely we have now improvisations in our lab, techniques, where we are doing these genetic testings, and we have good labs now who are doing the BRCA1, BRCA2 testing. And those are not only telling us about the risk, but also guiding about the treatment outcomes, because those patients who ovarian cancer patients who harbor the BRCA mutations have to be offered something more than the routine treatment of chemotherapy for a certain period of time. So these things will help us in guiding our treatment. Definitely, there'll be better tools to diagnose ovarian cancer early, because as we know that we don't have as such any screening test for early detection of ovarian cancer. So definitely, we'll be looking forward to some AI tools which will help us diagnose the ovarian cancer early, like some sort of an imaging which will pick up the ovarian cancer early, and also certain blood tests which will help us diagnose it early. And this is too early to say what digital AI tools we have right now to diagnose it early.
Right. So I think rightly said that not only the symptoms, present vaguely, but we don't have a proper screening tool as well. So if we have something in future, the digital tool which will help us, pick up ovarian cancer early, that will be of great help. So Dr. Manasi, please say hi once more
Yeah,
because
can
I
you
think
hear me now? Because I
yeah.
think I rejoined. Okay.
Right.
Sorry.
So, okay. So, I was asking you about the myth which you want to, burst here about the ovarian cancer. Definitely, that would help our audience.
Sure. So I think one of the important things to remember is ovarian cancer is of different types, and it can happen at any age. So it is not necessarily just a disease of the old age. There are certain ovarian cancers which are more common in your teens. So even patients who are in their 18, 19, 20 years, they can also develop ovarian cancer. Second thing is, if you have ovarian cancer, certain kinds of ovarian cancer, you can save your ovary. So you can just, if it's very early stage, you can just remove either a part of the ovary or one ovary. That is something that we call fertility sparing surgery, which is okay for some types of ovarian cancer. And the third myth I would like to say is, stage 4 ovarian cancer is incurable. So that is not true in this day and age. You can cure stage 4 ovarian cancers as well.
Right. So, before I, give some closing remark, I would like to ask all my panelists a very, very important question. This is an awareness campaign. So, how can campaigns like today make a lasting impact beyond just World Ovarian Cancer Day? So, I'll start with Dr. Vibha first.
Pardon?
Dr. Vibha, please let us know
I
that
didn't
how
get your
can
question. I
yes.
didn't get your
So,
question.
how can
Yeah.
campaigns like today make a lasting impact just beyond World Ovarian Cancer Day?
Yeah. So, it is very important to have these type of campaigns, not only for early detection, because, most of the people, even in the doctor fraternity, we sometimes ignore our health. We are so busy and caught up in our own lifestyle and in our own day-to-day work that we actually don't go for any screening programs. So it is very important to, look for symptoms, early symptoms like I have mentioned, fullness of the abdomen, dragging pain, early satiety, or some urinary symptoms, and late stages, even the bowel change in habit. So it is very important that if you are seeing any change in your body, you need to consult a doctor. I mean, you just don't ignore it and just push it under the carpet. So one is, looking for early symptoms. And then if you actually have cancer, there is no need to panic. You need to go to a center where there is a multidisciplinary team so that you get the proper and correct treatment for your cancer. And then there are support groups. So it is very important, like you said, we have these awareness programs. So not only for early detection, but also to help patients tide over their treatment complications or the morbidity associated with the treatment. And these all campaigns can help the patients also in getting over their cancer in a brighter, and look at the brighter side of it, that if you are going to have a treatment for cancer and you develop certain side effects, there are help groups which can help you tide over those difficult times. So my message is that you pick it up early. You, even if you are diagnosed, don't ignore it. Go to a proper center where there is multidisciplinary facility which is available. Get the right treatment and do as the oncologist says.
So, Dr. Uma, your message: how can campaigns like this, help our audience just beyond World Ovarian Cancer Day?
So I always say, for all my cancer awareness talks in October, especially breast cancer awareness, the awareness should not stop today. the thing, the education has to continue. If you hear this program today and you think it was useful for you, and if you thought you learned a lot, you carry that message, spread it amongst your neighbors, spread it to your friends, tell amongst your community, your relatives, and maybe share the link so that they all also can listen and be informed. So it should not happen one day, but yes, like, it's an occasion where we can actually discuss and talk about these things, but this should continue daily. Try to educate the next person, try to remain informed. There are lots of programs, and if you have any doubts, do connect with a doctor so that they can clear all your doubts. So, like, again, I'll say the education should continue, and education is educating patients, educating the public is going to go a long way in treating the patients correctly, as well as creating awareness about the symptoms so that they come to us on time.
Dr. Jyoti.
Hi.
So,
Uh,
yeah, hi.
can you
Yeah, I
hear me
think
now?
yeah, yeah.
Yes.
So I
Yeah.
think extremely important, and ultimately we need to really increase awareness, whatever could be the means. We need to enhance and escalate these means as well. So one thing is that we have to tailor made these awareness campaigns. Tailor made in the sense that we have to individualize risk stratification. As we said, that there are certain individual with a garden variety of risk. There are certain individual with increased risk. So that should be dealt with differently. Also, we need to leverage in today's context social media, and it is extremely important. We need to personalize. We talk about personalized treatment. I'm a proponent of precision therapy, personalized therapy. Similar time, we need to have a personalized or precision awareness campaigns, because not everybody's risk is similar, and similarly they do not need the similar kind of approaches. One size fits model doesn't hold true. So when we should be, as you also asked in the last question about AI, use of AI. So I believe artificial intelligence has come in a big way, even for preventive aspect, even for awareness. We need to incorporate those things, and there can be social media, social media involvement, and then people can, with the help of AI, they can see their own possible risk, and then how to go into. There is simulation models also which works in today's context, and with these simulation models they can virtually visit to cancer center, because many people are very apprehensive to go even for screening. So those simulation models can give them a feel that how it will be when they go for screening, when they do this, that, and then even with these models they can calculate their risk and do the preventive strategies. So I believe this is a very high time. We need to enhance these things, and then we need to use hashtags. We need to use all kind of systems wherein we can escalate this awareness. And also our societies, these messages should be culture sensitive. The thing which will work in India will not work in some other place. The thing which will work in Mumbai will not work in remote places. So we have to be very sensitized, again personalized in this way. And second, by all these means we need to motivate them and destigmatize. Lot of time I feel still today, even the educated people, they say that I want to hide my diagnosis. I don't want that people should know about it. There is, when we say that there is nothing which, like, there is a sin, that's where you are getting into such diseases. It is only a disease like diabetes or hypertension, but probably our society has not accepted this still. So that's where, when we see in US, UK, Europe, that people are really wearing ribbons and coming in front, and they are saying they're survivors, fighters, or whatnot, still our society is lot many times they want to hide. And that is where we are still losing on early detection. So we should lead campaigns to destigmatize this cancer diagnosis. Any cancer diagnosis, come in front, get diagnosed fast, and then take help of all these means. One very small word about sexual minority cancer also, because right now I'm working with LGBTQ plus cancers. There's not much progress in that segment, and this also needs to be done, because they require a different kind of screening. They require a different kind of addressing and providing a safe space. In my current institution, we are trying to provide a safe space for all these unique population, rare variety of cancers, and people with sexual minority people as well. So I think together we can make a difference, and we need to really scale it our strategies and make them much more effective than what it is today.
Very well said,
So
Dr.
I
Jyoti. I also believe that silence should no longer be an option, and we should come up and not only spread the word. We can use the social media handles. We can use campaigns like this to create awareness. Dr. Darshna, please, can you tell us in what, in your view, campaigns like this do to create an
Um,
impact?
I echo with my colleagues. I mean, these kind of campaigns, I really like the fact that, this is virtual because, that it is recorded and then people can keep reviewing this time and again. It is important that people understand that, this particular cancer, the ovarian cancer, and some other cancers like breast, colon, they are 90% caused because of the lifestyle disorder, and it is very much in their own hands to control that part. Unfortunately, only 10% do have genetic reasons for the same. All these, can all these reasons can be also, detected and taken, evaluated, and all the necessary treatment can be done even for this kind of a genetically affected group. Also, it is important that we know that minor symptoms also need our attention, and one should be, listening to their own body, taking the necessary investigations at a very early stage rather than shying from it. And because, the earlier you detect, there is more cure. But as we have, seen this entire spectrum, there's a variety of cancers in the ovarian cancer, and there are multiple treatment options available. There are multiple methods of investigations. So let us not shy from taking the advantage of the current availability, and we should also try not to be, shy in, disclosing the fact that you are a cancer patient or a cancer survivor, so that others can also find some courage out of your story, and try to lead a positive lifestyle, and a very open mind to the current situation. Thank you.
Thank you. Dr. Manasi, your reviews about it. I think I think there's no network. Dr. Tonse, are you there?
Yeah, hi. Sorry
Hi.
about the technical glitches.
Yeah.
So these kind of campaigns create more awareness in general public who do not know how to correlate each and every symptom with what disease. So people coming up speaking about their experiences, clinicians sharing about how to pick up your symptoms related to ovarian cancers like early satiety, bloating sensation, pelvic pain, which we generally women ignore, thinking this as some minor gas acidity, gastritis, etc. So people when they come and speak about this, create awareness in general public. So a patient goes to a doctor, gets herself checked up, does investigation like CA-125 and ultrasound, which are very simple, easily available in any areas, and then takes attention from an oncologist, gets treated where there is a multidisciplinary arrangement of doctors like oncosurgeon, a medical oncologist, and a good histopathologist, and also a genetic counselor, and facilities for genetic testing is available. So it has to be streamlined therapy which can be catered to if patient gets attention at the right time. So things like educational activities like this will create more awareness, more public awareness, so that a lot of people can be picked up early and can be cured, and their family members can also be screened if there is a family history, and we can give them a good life.
So, on that note, I also believe that silence is not an option. I repeat again, and let's take this panel as a call to action for all the clinicians, all the policymakers, all the communities. so that they can work together and change the narrative around ovarian cancer so that it can be picked up early. So I thank all my panelists for joining us today and giving your insights. Thank you very
Thank you.
much.
Thank you so much. Thank you, Dr.
very
Manisha.
much.
Bye.
Thank you, Dr.
Thank you.
Manisha. Thank you.
Thank you, Dr.
Thank
Manisha.
you all.
Thank you. And I just
Dr.
want to say
Manisha.
in the end that cancer should not stop our courage, and we should together try to beat the cancer so that the life's good moments keeps happening in everybody's life. Thank you
Yeah,
very
and
much.
also, now there is a demographic shift also. We are seeing more and more ovarian cancer in younger women also. Unlike, the previous times where it was more a disease of postmenopausal women. We are seeing more and more younger women, again, for the lifestyle changes that has been pointed out by the panelists, that it is more of the lifestyle changes, which is, there's a demographic change in the way of presentation, more younger women coming up with aggressive diseases. So there is a lot of need for awareness, such programs.
Right,
Yeah, every
rightly
ribbon
said.
matters. I think not only ovarian
True.
cancer, every ribbon matters for every cancer. We need to keep
That's true.
spreading awareness. And thank you very much for all of
Yes.
your efforts.
Thank
Appreciate.
you.
Thank you.
Thank you.
Yes.
Thank you.
Thank you.
Thank you so much.
Thank you.